My client is kind enough to let me film her presentation. I've screened the hip joints. Motion is good in all directions. I find pelvic asymmetry, and some people would say that that's caused in the SI joint, and I don't think it is. Let me move my camera and get a lateral view, and maybe the video will be able to demonstrate that. I don't know. Okay, so her right ilium is lower than the left, okay? And if I come underneath the ASISs, that's also obvious. It's a little bit anterior here, okay? Now, some people will tell you that's an anterior ilium and the ilium rotated on the sacrum. The problem is the rotation in that joint is 2 degrees or less. I cannot visually see 2 degrees of rotation, okay? If that was true, there would be a rotation in the pubic joint, and when I palpate the pubic joint on both sides, allowing a space for that cartilage in the middle, it's completely symmetrical. So I call this a twisting pattern of the whole pelvis, okay? Even though it blocks motion in a certain direction, translating through the sacroiliac. So I can load and get spring mobility through the left hemipelvis. When I do that same test on this side, the motion is already taken up, and if I significantly increase my pressure, I don't get any rotational mobility. Okay, let's have you line your stomach. And that is also reflected in, she can rotate forward, she can go further into that pattern, but this motion is absent. Going inferiorly is absent, which would take her out of that pattern. So it's going to take a larger passive force to restore that motion. Okay? Now, the camera is not going to capture the subtle movement in her upper neck. But basically, this rotational pattern in the pelvis rotates her pelvis to the left, and the body has a righting reflex. It's driven by the nervous system, and she rotates the other direction up high at the first vertebrae called the atlas, or C1. And C1 has a lot of rotation. It can rotate left and right almost 45 degrees. Okay? And that's an easy area for her to compensate and rotate the other way because it only has the weight of the head above it. And the average head weighs, 9 to 12 pounds. Okay? So that's how the body gets the eyes horizontal, and maybe it has to do with equalizing circulation of the brain. It's called a righting reflex. And basically, when we restore motion through the pelvis, then her upper neck will probably release automatically with no need for me to treat that. It's just an interesting finding. Okay? And I'm going to have her do a self-treatment twice a day for a week. And then after that, you can do it once a day to prevent this from coming back. Let's have you lie on your back. And it's very simple to self-treat an anterior ilium. And what you do is you hug the right knee and bring it outside the right shoulder. Perfect. Very good. So the knee is pointing just outside the right shoulder. The other leg is kept straight. That helps stretch the soft tissues on the opposite side as well. The anterior muscles, the hip flexors and quads get a nice stretch as well. Let's just keep filming and do this for about a minute, and then I'll retest your motion. So the description of this pattern, the terminology is right anterior ilium. That's the terminology I use. But almost everybody else uses that to imply motion in the SI joint, and I submit that we cannot evaluate that motion in the clinic. We simply don't know. It could be the whole pelvis twisting on the hip joints. Good, so let's come down from that. It's very important for the patient to come back after a day or 2 or 3, because sometimes they come back with a different pattern. Sometimes they come back and they have a restriction in the opposite direction on the opposite side. That's how the pelvis behaves. But now it looks much more symmetrical. I can now load it and I can now spring it. Okay? Here's the front of the pelvis on both sides. And here I am under the ASISs. Still a little asymmetry, and maybe that's how you're made at the factory. You could have a developmental pelvic asymmetry. So because it moves, my goal is not to make this completely symmetrical, because I don't think I can. I think that's the bony development. And all the muscles develop with that. It's not a adverse thing. It doesn't cause pain to have a pelvis that is asymmetrically developed, and a lot of people have that.
Right.
So lie on your stomach. And now we have inferior mobility on the right. Okay? And let's have you lie on your back, and I'll test your upper cervical. So I'm not going to change the camera angle.
Okay.
I'm putting my fingers under the mastoid, below each side of the C1 vertebrae, and this muscle is much softer now on the right side, and I can now lift up with my index finger on the right, and I can induce left rotation. So that did in fact reflexively release when we restored motion in the pelvis. So thank you so much. I appreciate the opportunity to film this.